Hello everyone, let's discuss middle cranial fossa. Now it is a depression situated behind anterior cranial fossa. It is butterfly in shape. It is narrower in the midline and expanded on either side. So you can see over here, this is the outline of middle cranial fossa. Now let's see the bones contributing in formation of middle cranial fossa. Now we know this is sphenoid and this is its body. So the median area of middle cranial fossa is contributed by body of sphenoid. Now on either side these two are expanded greater wing of sphenoid. Okay, so that will contribute to form lateral area of the middle cranial fossa, and posteriorly that lateral area is contributed by squamous part of the temporal bone. This is temporal bone of left side and this is right side. Now let me join these together. So this is squamous part of the temporal bone and posteriorly this is petrous part of the temporal bone. So if we join these three together, the sphenoid and two temporals, so that will make a complete middle cranial fossa like this. See this is how the middle cranial fossa is formed. So in the center you can say it is contributed by body of sphenoid, and on either side there is greater wing of sphenoid, squamous temporal bone and anterior surface of petrous part of the temporal bone. This is petrous temporal bone, this is apex and this is anterior surface. So that portion is contributed in lateral area of middle cranial fossa. So this is how the middle cranial fossa is formed, and that lodges temporal lobe of the brain. Now let's see the boundary of middle cranial fossa. So in the median area, anteriorly it is bounded by posterior margin of jugum sphenoidale. Okay, this is jugum sphenoidale and this is its posterior margin, which is continuous on either side with anterior clinoid process. You can see over here, and that is continuous with posterior sharp free margin of lesser wing of sphenoid. So that is the anterior boundary of middle cranial fossa. Basically it is the posterior boundary of anterior cranial fossa, so that is same, that is forming anterior boundary of middle cranial fossa. And posteriorly you can see over here, this is body of sphenoid, its posterior part, and that forms a bony prominence that is termed as dorsum sella. So on either side of dorsum sella there are two prominent posterior crinoid processes that is forming posterior boundary, and that is continuous with superior border of petrous temporal bone. This is petrous temporal bone, this is its anterior surface, this is its posterior surface, and in between these two is the superior border of petrous temporal bone. So along with dorsum sella, posterior crinoid process and superior border of petrous temporal bone forms the posterior boundary, and laterally it is continuous with the squamous part of the temporal bone. Over here you can see. So this is the middle cranial fossa and this is how it is bounded. Now let us see individual parts. Now in the median area, from before backwards beyond jugum sphenoidale, let's see the structures. Now as you know, it is contributed by body of sphenoid. So behind jugum sphenoidale there forms a sulcus, you can see over here. Now that sulcus is termed as sulcus chiasmaticus, and on either side it leads to the optic canal, you can see over here. So this is sulcus chiasmaticus. Now it is a misnomer, it is not lodging optic chiasma, but it is related to anterior communicating artery. The optic chiasma is related somewhere posterior superior to this sulcus chiasmaticus, somewhere over here. Now behind sulcus chiasmaticus, you can see over here there is a bony ridge. Let me bring it closer. You can clearly see this bony ridge. This is termed as tuberculum sella. Now on either side of tuberculum sella there are two clinoid processes. These are termed as middle clinoid processes. Now a ligament connects middle to the anterior clinoid process, that is termed as carotidoclinoid ligament. Now that ligament will form a foramen, that is termed as carotidoclinoid foramen or carotid foramen, which will allow passage of internal carotid artery. So here there is formation of a foramen in relation to middle and anterior clinoid processes. Posterior to tuberculum sella there is a depression in body of sphenoid, you can see over here. This is termed as hypophyseal fossa or pituitary fossa, and that lodges pituitary gland. Now below it is related to sphenoidal air sinuses, you can clearly make out. So below pituitary fossa are the sphenoidal air sinuses. Now posterior to pituitary fossa there is a bony bar which is termed as dorsum sella. You can see over here, this is dorsum sella, and on either side of dorsum sella there are two posterior clinoid processes. These are again bony spicules extending from either side of dorsum sella. So in front is tuberculum sella, in middle is pituitary fossa or hypophyseal fossa, and posterior is dorsum sella. These three structures together, they look like a Turkish saddle, or they are also termed as sella turcica. Now posterior clinoid processes will provide attachment to attached margin of tentorium cerebelli. Let me show you in diagram. Now here in this diagram you can see this is tentorium cerebelli, which has got an U-shaped free margin which is attached to the anterior clinoid process that we have discussed, and this is the attached margin which is attached to the superior border of petrous temporal bone and then to the posterior clinoid process. Now over here you can see there is a crossing of free margin and attached margin which is related to oculomotor and trochlear nerves. Now over here these two nerves will pierce the dura mater and then they will enter into the cavernous sinus, which is related somewhere over here. Now on either side of dorsum sella along its lateral border below posterior clinoid process there is a bony spicule, you can see over here, and that is connected to the apex of petrous temporal bone via petrosphenoidal ligament. Let me connect both. So this is the petrous temporal bone, and if we connect with the sphenoid over here you can see, so they are connected now, and you can see over here this is the petrous temporal bone, this is its tip, and this tip is connected to that bony spicule via petrosphenoidal ligament. Now below this petrosphenoidal ligament abducens nerve runs and it enters into the cavernous sinus which is situated on either side of body of sphenoid. So here is the attachment of petrosphenoidal ligament. Now on either side of body of sphenoid you can see over here there is a sinusly curved groove and that lodges internal carotid artery. Basically over here this portion of the body of sphenoid or the side of the body of sphenoid is related to cavernous sinus, and within cavernous sinus the groove is lodging internal carotid artery or the cavernous part of the internal carotid artery. Posteriorly it enters into the cavernous sinus from the anteriormost part of the foramen lacerum. So here somewhere there is formation of foramen lacerum. Let me join the temporal bone again. So this is how the foramen lacerum is formed. You can see over here it is related anteromedially to the body of sphenoid and posterolaterally to the petrous temporal bone, apex of petrous temporal bone, and anteriorly it is related to the greater wing of sphenoid. So this is how it is bounded, and in living the foramen lacerum is filled by a cartilage, an emissary vein and meningeal branch of ascending pharyngeal artery. These two structures are traversing through the foramen lacerum. Now if you see the petrous temporal bone from in front over here, you can clearly make out that over here near the apex there is carotid canal, okay, which starts from the base, and over here you can see this is carotid canal, so through which the internal carotid artery emerges out and it runs temporarily in the foramen lacerum in its upper part and then it enters into the cavernous sinus. So that portion of the internal carotid artery which traverses the petrous temporal bone is termed as petrous part of the internal carotid artery, and then it enters into the cavernous sinus, that is termed as cavernous part of the internal carotid artery. Once it pierces the roof of the cavernous sinus passing through the carotidoclinoid foramen, and it becomes the cerebral part of the internal carotid artery. So here there is formation of foramen lacerum. Now if you see it from behind, you can clearly make out that anteriorly it is related to pterygoid canal which is found within the sphenoid, and this pterygoid canal will lead to pterygopalatine fossa over here. So this is pterygoid canal, and for detailed description of pterygopalatine fossa and its connection you can see my separate video of pterygopalatine fossa. So over here in the pterygoid canal there is formation of Vidian's nerve or nerve to pterygoid canal which is formed by fusion of greater petrosal nerve and deep petrosal now. Now let's see lateral area of middle cranial fossa. As you know, it is contributed in front by the greater wing of sphenoid, laterally by squamous temporal bone, and posteriorly by anterior surface of petrous temporal bone. Now this is lesser wing of sphenoid. Okay, and between greater wing and lesser wing over here, if you see from behind, you can clearly make out there is a retort shaped gap, and this gap is termed as superior orbital fissure, which leads to the orbit. Now within greater ring of sphenoid, there are multiple foramina like foramen rotundum, foramen ovale, foramen spinosum. So through foramen ovale and foramen spinosum, the middle cranial fossa communicates to the infratemporal fossa over here, and laterally this is squamous part of the temporal bone. So the middle cranial fossa, laterally it is related to the temporal fossa. So in front there is orbit, below is infratemporal fossa, and laterally is the temporal fossa. Now let's see the superior orbital fissure. Now it is a fissure or retort shaped gap between lesser wing of sphenoid, greater wing of sphenoid, and body of sphenoid. And this is a connection between middle cranial fossa and the orbit. Now let me explain the fissure in a diagram. So before explaining in the diagram, just see this is a retort shaped gap from behind from middle cranial fossa, and if you see the left superior orbital fissure from the orbit, this is how it looks like. So above is the lesser wing of sphenoid, below is the greater wing of sphenoid, and medially is the body of sphenoid. Now in the lower part, in the lower boundary, you can see over here there is a bony spicule in the greater wing of sphenoid. Now this bony spicule will provide attachment to tendinous ring of Zinn, which will divide the superior orbital fissure into medial, intermediate, and lateral areas. Now let's see the diagram. So here in this diagram, you can make out this is the lesser wing of sphenoid, this will be the greater wing of sphenoid, here will be the body of sphenoid. And as you know, lesser wing of sphenoid will split to form anterior and posterior roots, and in between it forms optic canal. Now this optic canal will allow passage of optic nerve, ophthalmic artery, and the meninges. Now as I told you, the greater wing of sphenoid along the lower margin of superior orbital fissure shows a bony spicule, and that provides attachment to tendinous ring of Zinn. Now this tendinous ring of Zinn also includes optic canal, and this tendinous ring of Zinn will divide the superior orbital fissure into medial, intermediate, and lateral areas. Now let's see the structures passing through superior orbital fissure. Now in the lateral area, you can see there is an artery which is a recurrent meningeal branch of lacrimal artery, which will form anastomosis with the corresponding branch of middle meningeal artery. And additionally, there are three nerves, namely LFT. This is how you can remember. L stands for lacrimal, F stands for frontal. These two are branches of ophthalmic division of trigeminal nerve, and T stands for trochlear. So these three nerves are passing through lateral compartment or lateral part of the superior orbital fissure, and there is a mnemonic you can remember, LFT. Additionally, there passes superior ophthalmic vein or multiple superior ophthalmic veins. So these many structures are passing through lateral part of the superior orbital fissure. In the middle part, it allows passage of mainly nerves. So two divisions, upper and lower divisions of oculomotor nerve will pass through it, and in between there lies nasociliary nerve. Again, nasociliary nerve is a branch of ophthalmic division of trigeminal nerve, and below to that it allows passage of abducent nerve. So these many nerves are passing through the middle compartment, and medialmost compartment will allow passage of inferior ophthalmic vein. So this is about superior orbital fissure. Now below and behind, three foramina, mainly three foramina are found in the greater wing of sphenoid, which are oriented crescentrically. You can see over here. So first is the foramen rotundum, second is the foramen ovale, and third is foramen spinosum. So these three foramina are found crescentrically oriented within greater wing of sphenoid. Now first is the foramen rotundum. As the margin are rounded, the name given to it is rotundum. Foramen rotundum, which allows passage of maxillary nerve, and this leads to pterygopalatine fossa in front. So maxillary nerve from cavernous sinus will reach to the pterygopalatine fossa via this foramen. Now below and behind to foramen rotundum is oval shaped foramen ovale. that we already discussed in Norma basalis, but let me just revise. This foramen ovale opens below into the infratemporal fossa, and four structures M, A, L and E, they will pass through it. M stands for mandibular nerve or mandibular division of trigeminal nerve. A stands for accessory meningeal artery, which is a branch of maxillary artery. L stands for lesser petrosal nerve, which is a branch coming from the tympanic plexus in the middle ear, and ultimately it is a branch of glossopharyngeal nerve. And E stands for emissary vein, which communicates pterygoid venous plexus, which is found in the infratemporal fossa, to the cavernous sinus. Now, posterolateral to foramen ovale is a foramen spinosum. Again, it communicates the infratemporal fossa below to the middle cranial fossa above, and we already discussed the structures passing through it in Norma basalis, but again let me revise. Three structures will pass through it, and you can remember a mnemonic like 3M. So first M stands for middle meningeal artery, second N stands for the meningeal branch of mandibular nerve, that is also called as nervus spinosus, and third M stands for posterior division of middle meningeal vein. So that is about foramen spinosum. Now, apart from these three main foramina, sometimes two additional foramina are also observed. Number one is emissary sphenoidal foramen or foramen of Vesalius. It is found between foramen rotundum and foramen ovale, somewhere over here, and it allows passage of emissary vein. Again, it communicates pterygoid venous plexus to the cavernous sinus. And second additional foramen will be found between foramen ovale and foramen spinosum, that is termed as canaliculus innominatus, and whenever it is present, it allows passage of lesser petrosal nerve. So from middle cranial fossa, lesser petrosal nerve will enter into infratemporal fossa. Now, rest of the greater wing of the sphenoid, it is hollowed out and it lodges temporal lobe of the brain. So lateral to greater wing of sphenoid, you can see over here, this is squamous part of the temporal bone, and if you focus on foramen spinosum, this is again we have discussed, it is allowing passage of middle meningeal vessels, and these vessels will indent partly in the squamous part of the temporal bone and partly in the greater wing of sphenoid. So in the lateral area you can see multiple vascular markings because of middle meningeal vessels and certain bony irregularities. Now these together will lodge the temporal lobe of the brain. Now posteriorly, the middle cranial fossa is formed by anterior surface of petrous temporal bone. Now along the anterior surface of petrous temporal bone, there are certain bony features. Let's see them individually. So most medially, the apex is related to the formation of foramen lacerum that we have discussed, and the tip is providing attachment to petrosphenoidal ligament, that also we have discussed. Next to that, the anterior surface shows a notch, you can clearly make out, and that notch is extending up to the upper border. Basically, this upper border is providing attachment to attached margin of tentorium cerebelli, that also we already discussed, and that also lodges superior petrosal sinus. Now near the apex, the upper border shows an indentation or the notch, you can clearly make out. Now this notch is lodging motor and sensory root of the trigeminal nerve, and beyond that, along the anterior surface, there is formation of a meningeal cave, an outpouching of the meninges, and that is termed as trigeminal cave or Meckel's cave or cavum trigeminale, which lodges trigeminal ganglion. So here lies the trigeminal ganglion. From the trigeminal ganglion, three roots are coming out: ophthalmic, maxillary and mandibular. So the ophthalmic division will enter into the supraorbital fissure via cavernous sinus. The maxillary division will enter into the foramen rotundum, again via cavernous sinus, whereas the mandibular division will pass through foramen ovale into infratemporal fossa, and it bypasses cavernous sinus. So out of three divisions, only ophthalmic and maxillary division are found within the cavernous sinus. So here there lies trigeminal ganglion within cavum trigeminale. Now next to that notch, there is a depressed area, you can see over here. Now this depressed area is basically forming roof of internal acoustic meatus, which is found along the posterior surface of petrous temporal bone. So here this portion is forming roof. Next to that portion is the bulging area, you can see over here. This is termed as arcuate eminence. which is lodging superior semicircular canal of internal ear. Now basically this area or this portion of the bone is tegmen tympani. It is termed as tegmen tympani, which is a bony plate and that is forming a continuous roof of mastoid antrum, which will be somewhere over here. Mastoid antrum, middle ear cavity or tympanic cavity, and canal for tensor tympani, which will be somewhere over here. So a continuous roof of these three structures are formed by a bony plate, which is termed as tegmen tympani. So this is the tegmen tympani, and anteriorly over here you can see there is a canal. This is canal for tensor tympani, through which the tensor tympani muscle passes, and now below to that canal there is another aperture you can see, and this is the bony part of auditory tube. Now it will become more clear if we join the sphenoid along with, and if you see it from below like we have discussed in norma basalis. So now you can clearly make out here is a formation of sulcus tuba. This is foramen ovale, this is foramen spinosum. Here will be the carotid canal in the petrous temporal, and this is sulcus tuba lodging cartilaginous part of the auditory tube, and behind to that will be the bony part of the auditory tube, and it is related to the canal for tensor tympani. So same thing you can make out. Over here will be sulcus tuba. This is the bony part of the auditory tube, and above to that is the canal for tensor tympani. So that is contributed by tegmen tympani. Additionally, the tegmen tympani will show two foramina. One is hiatus for greater petrosal nerve, and one is hiatus for lesser petrosal nerve. Now greater petrosal nerve is a branch of facial nerve, and it will come out from middle ear cavity through this hiatus, and there is a formation of a groove which will lead to foramen lacerum. So greater petrosal nerve will reach to the foramen lacerum, where it will be joined by deep petrosal nerve to form nerve to pterygoid canal, that will pass through pterygoid canal to the pterygopalatine fossa. Another is hiatus and groove for the lesser petrosal nerve. Now again the lesser petrosal nerve is coming from the tympanic plexus within middle ear cavity, and once it comes out it lodges into that groove, and that leads to the foramen ovale or canaliculus innominatus. So both these nerve will come out from middle ear cavity through these two hiatuses. So the hiatus and groove for the greater petrosal nerve from tegmen tympani will reach to the foramen lacerum. Over here you can see, and hiatus and groove for lesser petrosal nerve will reach to foramen ovale or canaliculus innominatus. Now last thing about tegmen tympani is over here you can see this is tympanic plate, and this is the squamous part of the temporal bone. So in between these two you can see a bony buttress or small bony portion, that is nothing but continuity of the tegmen tympani, you can clearly make out. Now that will divide the squamotympanic fissure into petrotympanic and petrosquamous part, that already we have discussed in the norma basalis. So this is about the middle cranial fossa. Hope you understood well. Thanks for watching.